Thank you for joining us right here on Midday Kentucky. Dr. Henry Wells, board certified plastic surgeon from Wells Plastic Surgery and Skincare. And today we're talking all about the mummy makeover. Welcome to the show for the first time, my friend.
Well, it's great to be here.
Thank you for joining us. Well, we often talk about a mummy makeover. Where do we start? What sort of age should women start looking when considering a mummy makeover?
Well, it's not so much a question of age, but it's a question of have they had children. And after they stop having children, there are changes that have occurred as a result of pregnancy. The abdomen expands to accommodate the baby, and the breasts get larger in order to produce milk for the baby. And when that's over with, the breast will deflate, and you have laxity of the abdominal muscles and the abdominal skin.
So you're really saying once you've decided not to have any more children is the time that you should think about considering a mummy makeover. Let's just talk about what actually is a mummy makeover. Now, are there two different parts to a mummy makeover, or is it the full gamut?
Well, there are two different areas of the anatomy that we deal with. The first is the breast, and the breast, obviously the breast stretches and loses volume after pregnancy. And we have augmentation that we can do to improve the shape and size of the breast, or we may have to lift the breast, or we may have to do a reduction on the breast.
I understand. And then you would think about doing
the tummy.
The tummy.
And we do them both at the same time.
Oh, really?
Yeah. The tummy is pretty much the same for everyone. We remove the excess skin and tighten the abdominal muscles in order to restore the contour of the abdomen.
So is that what we know in the public as a tummy tuck?
Exactly.
So with a tummy tuck, we all know that's quite an invasive procedure, yes?
It is.
And what are we looking at downtime? Is the downtime similar if we just did a breast augmentation or just a tummy tuck? By doing them both, does that stretch out your downtime?
Well, the tummy tuck is a limiting factor. That takes about 3 weeks before the patient can go back to work.
Yes.
The breast surgery, on the other hand, most patients go back to work after a week.
So when you were just saying back after a week. Now, when you have a mummy makeover, that doesn't necessarily mean you have to have all of this done, because you might not need to have your breasts done. You might just need to have your stomach done, yeah?
Well, that's true. And sometimes patients will have breast surgery and then may come back later and decide to have the tummy tuck, or vice versa. I have a lot of patients that come in for breast augmentation, and they'll say, well, while you're at it, can you take a look at my tummy? And so one thing leads to another.
So with a tummy tuck, is liposuction involved in that, doctor?
Yes, I do liposuction on just about all of my tummy tucks.
Really?
Yes.
And what are your views and thoughts about when you're doing liposuction, moving the fat from one part of the body to another? So as an example, injecting it into the face. Where do you sit with that?
Oh, I think it's one of the most useful tools we have.
Really?
One of the things that happen as we get older is we lose volume in the face, and to restore that with your own fat is a great tool to have.
I think it's fantastic, and we're looking at one of your patients now that you did a full makeover on. She looks, I have to tell you, everyone sitting at home, if you go over to Dr. Wells' website, this woman looks absolutely amazing, Dr. Wells. What did you actually do on her?
Well, as far as the body surgery, she had a breast lift and breast augmentation and a tummy tuck with liposuction.
Absolutely stunning. And we're not showing her face because I want everyone to see that for our next topic of conversation. Now let's look at the next one that you did here as well. Here's another one. I can't tell you. The same swimsuit, everyone, just so you know at home, these pictures aren't doctored. This is the real thing of what is possible. Now, what are we looking at here?
The same thing. She had a breast lift, breast augmentation, and a tummy tuck with liposuction.
What sort of length in surgery would this procedure take?
It can take anywhere from 5 to 6 hours to do, depending upon the length of the breast surgery. The tummy tuck usually takes around 3 hours.
Okay, now talking about, we would need to call up, make a reservation. We need a reservation, let me tell you. But you need to have a consultation first to see if you are the right candidate for this.
That's right.
Is that correct? So they would have an appointment with you first?
They'd have an appointment with us. We'd discuss the surgery. They'd learn about the procedure and the fees, and they would look at our schedule. And then they can determine if they want to do it or not, and then set everything up.
What sort of time period do you think it'll take? Let's just say we saw this conversation today. I've got a consultation with you next week. How long is the typical wait before I can get something done?
Well, that varies according to our schedule,
yeah.
and my scheduler is sitting right over there. She brought me out here today, but it usually can be done within 6 to 8 weeks.
I love that. Dr. Wells, thank you so much. We're really looking forward to getting more information for you over the next few weeks. There it is right now, 859-255-6649 is the phone number. You can give them a buzz, just give them a call to get a consultation. But as I said, head over to wellsplasticsurgery.com and really see what they do with all their before and afters. It really is amazing. Thank you so much. We really appreciate it.
Pleasure.
Well,